Right now, somewhere in the world, a doctor is handing a patient a small white pill. The patient swallows it without a second thought, and within days, an infection that could have killed them a century ago simply disappears. We call it an antibiotic. We treat it like tap water, always there, always available, barely remarkable. But here's the part that should stop you cold. Ancient Egyptians were doing something eerily similar, 3,000 years before the word antibiotic was ever spoken. So how did a civilization with no microscopes, no germ theory, and no laboratories accidentally stumble onto one of medicine's greatest secrets, and what exactly were they putting on those wounds? The answer starts with something most of us would throw straight in the garbage: moldy bread. Specifically, bread covered in the kind of greenish-gray fuzz that makes your stomach turn when you find it in the back of a cabinet. To the ancient Egyptians, that same fuzzy, decaying loaf wasn't trash, it was medicine. And what makes this story genuinely remarkable isn't just that they used it, it's that they figured out how to use it, documented it carefully, and passed that knowledge down through generations long before anyone on Earth understood why it actually worked. We know this because of two extraordinary documents that survived the ancient world. The Edwin Smith Papyrus, written around 1600 before Common Era, is one of the oldest known surgical texts in human history. Picture it: a long, carefully rolled scroll covered in hieratic script, a cursive form of hieroglyphics, describing battlefield wounds, skull fractures, and dislocations with a level of clinical precision that still impresses surgeons today. It mentions the application of moldy substances to open wounds. Then there's the Ebers Papyrus, from around 1550 before Common Era. Even longer, even more detailed, a sweeping catalog of hundreds of remedies and treatments. Both texts reference the use of rotting organic material, including moldy bread, applied directly to infected tissue. These weren't folk rumors scrawled on a cave wall. These were formal medical texts, organized, referenced, taught. Here's where it gets strange. Because for the next 3,500 years, the world basically forgot, or rather, it never connected the dots. Other ancient civilizations across Serbia, China, and Greece also have recorded uses of moldy bread or fungi on wounds. Healers across continents, separated by oceans and centuries, kept arriving at the same mold-covered conclusion, independently of each other, and yet not a single one of them knew why it worked. They saw the outcome. The wound healed, the fever broke, the redness faded. But the mechanism? The invisible war happening inside that decaying bread, that was completely invisible to them. For millennia, humanity held the answer in its hands without knowing the question. What those ancient physicians were observing, without knowing it, was the activity of a microscopic fungus called Penicillium. When bread goes moldy, Penicillium is often the organism responsible for that distinctive green-blue fuzz. And as it colonizes the bread, it releases a chemical compound into its environment, a compound it uses as a weapon to kill off competing bacteria and protect its territory. That compound is penicillin. When Egyptian healers pressed moldy bread against an infected wound, they were accidentally deploying one of the most effective antibacterial agents nature has ever produced. The mold wasn't just sitting there, it was fighting, and the bacteria infecting the wound were caught in the crossfire. What the American Chemical Society later documented in their landmark history of penicillin's discovery confirms just how real this effect is. Penicillin works by attacking the cell walls of bacteria, specifically the structures that give bacterial cells their shape and integrity. Without those walls, the cells rupture and die. It's targeted, it's efficient, and it works across a staggering range of bacterial infections. The Egyptian physicians couldn't see any of this happening, but their wounds healed at rates that must have seemed almost miraculous to the people around them. They didn't need to understand the chemistry. The chemistry worked whether they understood it or not. Let that sit for a moment. A fungus defending its food supply accidentally became one of the most important medicines in human history. And then, almost overnight in historical terms, the thread snapped. From widespread ancient use to complete obscurity to rediscovery, the timeline is almost cruel. For centuries after the fall of ancient Egypt, the practice of using moldy bread largely disappeared from formal medicine. It persisted in folk remedies here and there, whispered across generations in rural villages, but the knowledge that it worked, the systematic, documented understanding, was buried under the rubble of empires. It wasn't until September 3, 1928, that the connection was finally remade. Alexander Fleming, working in a London laboratory, noticed that a mold contaminating one of his petri dishes had created a clear ring of death around itself. No bacteria could survive near it. From that single contaminated dish, to clinical trials, to mass production during World War II, to billions of doses administered across the planet, all in the span of a few decades. 3,000 years of forgotten knowledge, rediscovered by accident because a scientist didn't throw away a ruined experiment. But what does this actually reveal? Not just about medicine, but about the relationship between human observation and human understanding. The ancient Egyptians were doing something that cuts deeper than medical history. They were trusting outcome over explanation. They couldn't explain penicillin. They couldn't name Penicillium. They had no microscopes, no cell biology, no germ theory. But they noticed, carefully and repeatedly, that something in the mold made sick people less sick, and they wrote it down. They built a system around it. They passed it forward. In a world where we often treat "I don't know why it works" as a reason to dismiss something entirely, ancient Egyptian physicians built a 3,000-year medical tradition on the honest acknowledgement that some things work before we understand why. That is not primitive thinking. That is extraordinarily sophisticated thinking. What if the most powerful force in medical history isn't the genius of a single discovery, but the quiet, stubborn persistence of human observation across thousands of years? What if the real miracle isn't Fleming's petri dish in 1928, but the unknown Egyptian physician in 1550 before Common Era who pressed a moldy loaf against a soldier's infected arm, watched the wound improve, and thought, "Write this down"? What does it mean that a civilization we often picture as mystical and unscientific was practicing evidence-based medicine, not because they had the theory, but because they had the patience to watch, record, and trust what they saw? So the next time you find a piece of bread gone fuzzy and green at the back of your shelf, you're looking at something ancient physicians treated with the kind of careful respect we now reserve for surgical tools. That mold isn't just decay. It's a chemical arsenal, 3 billion years in the making, that a civilization mapped and used and documented and lost and rediscovered, and that now, in its refined form, has saved an estimated 200 million human lives. The Egyptians didn't have the word antibiotic. They didn't need it. They had something rarer and more powerful, the discipline to watch the world closely, record what they saw honestly, and trust that observation was enough, even when explanation was centuries away. We didn't invent the answer to infection in 1928, we remembered it.